Good evening, and welcome back for the second edition of the Homer Central School District Virtual Town Hall. This is certainly a stressful time for our community, and we hope these three interactive sessions will get everyone's questions answered to the extent possible, and that we can work together to make the best of an unusual situation. I know the teachers, administrators, and staff have been working very hard to get all the plans in place as quickly as possible, but please keep in mind that some regulations, protocols, and details just cannot be finalized at this time. But if we give each other a little support, we can create the best possible scenario for our students, our parents, and our families. So thank you for joining us again tonight. I am Luke Marinas, the Vice President of the Homer Board of Education. I will be gathering your questions and moderating tonight's forum. As you know, last night's session focused on questions related to instruction, and tonight we will discuss topics related to health and safety. Each of our interactive community sessions will be recorded and can be rewatched from the school website, Facebook page, or YouTube site. So, how will this all work? A panel of school officials will answer questions that were previously submitted, and we will also accept live emails during the forum as well. So how do you submit a question? You can submit questions via email. The email address is homerschoolreopening@homercentral.org. I'll say that one more time, homerschoolreopening@homercentral.org. Another way is to go to the school website, homercentral.org, click on the red banner for the reopening updates, frequently asked questions, and you can find the email address there as well. So once again, thank you, and tonight's town hall will focus on health and safety. Tomorrow's third and final session will highlight transportation and food service questions. We will try to stay on the given topic for tonight, but some questions may overlap into other areas. So please tune in or watch the recording of all three sessions if you want to be the most informed that you can. So with that, let's get to the good stuff. Joining tonight to answer our health and safety questions are Superintendent Tom Turk, Assistant Superintendent for Management Mike Falls, and the Homer Schools Nurse Coordinator Janie Connery, who's also a registered nurse. Also, special thanks to the staff that put this together tonight, especially Kelly Jacobone and Josh Finn for helping me to communicate the live questions in real time. So, thanks to the panel, thanks to the community, and thanks to the support staff. With that, let's get started. Tom, before we get straight to the questions about health and safety, could you provide a brief update on the work that has brought us to today's forum, and any updated information you can share since your last community video at the end of July?
Absolutely, and welcome, folks. We're glad that you're able to join us tonight. As you might expect, a lot of work has gone into our reopening plan efforts up to this point. That'll continue right up until the first day of school and then beyond. We had a large committee, a reopening team that we put together back in July, and after receiving guidance from the Department of Health and the CDC and the New York State Education Department, we formed a number of subcommittees that really dug deep into some of the topics that we knew were of high interest and of high need for us to address. I can't say enough about the work done by so many of you, including folks from our community in the healthcare field and the Homer Village. And I really do believe that we're on the right path to having what I hope to be a very successful return to school for our students in September. But I do want to say at the beginning, and I'll say it a couple of more times before we finish tonight, the plan's not finished yet, and it's an ever-evolving document. We get regular updates from those agencies that I mentioned earlier almost daily. And while they're helpful, it does give us the sense that we're never finished. And we're going to do our best to stay on top of those and communicate those to the community. I sent a video out on July 31st, and that was the date that we actually submitted our plan to New York State Ed. But we have some updates that I wanted to provide for you. We have obviously gotten further in our planning. We reached out to all of our school families, had them identify what what learning motto, transportation need, and meal plan their child was interested in. We've taken all of that information and from there started to build student schedules that we hope to finalize soon and get those out to families. One of the things that we did find out when we began to really look at those numbers of students returning to school in person and the spaces that we had given social distancing guidelines we realized that we were going to have to make some adjustments to where students would be going to school when they come back in person. So as it stands right now, and we don't see this changing from here forward, our pre-K students will be at our high school campus. Kindergarten and first grade will be at Homer Elementary School. Second through fifth grade will be at the intermediate school. 6th through 8 at Homer Junior High. And our 9 through 12 students will be at the high school. We've also put together a phasing plan that will begin on Tuesday, September 8th, which is our first day of school. We're going to prioritize bringing students back that are new to the areas in which they'll be learning this year. So we will be sending out before the end of this week a very detailed bit of information about what students will be coming each day for September 8th through September the 11th. But we will prioritize those students that I mentioned are new to their spaces. So our pre-K students, our kindergarten students, our second graders, our third graders, our sixth graders, and our ninth graders. And again, we'll give you more information so that everybody has that as well. So those two things have changed since July the 31st. And as I mentioned, we'll do our best to keep you updated as additional changes occur.
Thank you, Tom. And let's get back to the main topic of health and safety. Mike, one of the most frequent questions about school reopening centers around the daily screening of students and staff. Can you outline the screening process that will be used?
Sure. Thank you, Luke. Our staff screening process, we've been working with Cayuga Medical to use a pre-screening app that they've developed and have now worked with many organizations, both in Cortland and Tompkins County. Staff will be able to utilize the screening app daily, and after using that, if directed to do so, if follow-up is needed based on how they've answered the questions, they'll have the ability to schedule a telemed appointment for a faster follow-up if they need to proceed any further with the information that they've received. For student screening, we're going to be offering a pre-screening app through the school. Prior to the beginning of the school year, each family will be provided with a student ID card and information on how to log into our district app on a daily basis. Each day, the parents will be able to put the information in for children who are attending in person for that day. So the screening will not need to be done for someone who is home learning that day, only for in-person instruction. Parents will have the ability to put the information into the pre-screen system and allow their child to enter the school building in a quicker fashion. So what will that look like when children come to school? When children come to school, for those whose families have filled out the pre-screen app, they will enter a line at the school with a kiosk predetermined where they can line up and will have their ID card scanned. At that time, when the ID card is scanned, if it does check up that the screening app was filled out, and the child may proceed immediately to the class. If they go to the line, the pre-screen line, and that has not been filled out for the day, students then will be directed to the screening line. So in the screening line, they'll receive a temperature check and will answer age-appropriate questions. Again, we're going to have the children answer questions that are appropriate, that they will be able to understand and answer in the screening process. If they've been cleared, they'll proceed to class just as though they would if they'd gone through the pre-screening line. If the child does not pass screening, they'll be escorted to the building's nurse's office for further evaluation. It also should be known that children attending the before school program will also be able to use the pre-screening process through the school or be screened upon coming to the before school program. I'd like to hand it over to Janie Connery to answer what would happen if in fact in the screening process they needed to see the nurse.
Thank you. We have very specific guidelines that we're following that are recommended from the CDC and the Department of Health. So the symptoms, if they've answered questions or we've assessed them and found that they have any of these positive symptoms, they would have to go home directly and stay in our isolation room until a parent could pick up. And the symptoms that are most recently given to us by the CDC are fever or chills, and a fever is 100 degrees or greater. Cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. So any of those positive symptoms or complaints would trigger us to send them to the isolation room, and we would contact parents for immediate pickup.
Yeah, thank you very much. Let's just dive into the questions. I'll apologize in advance if I repeat some of them, but some of them probably are worth repeating. So without further ado, will masks be required at all times, or will students be allowed to remove them once seated at their desks?
I'll take that one, Luke. We talked about this last night, and it is an important thing, and we'll make sure that we mention it at each of our three meetings with the community. Yes, masks are mandatory for both students and staff. We do recognize that there will be a need for face mask breaks throughout the day. In following the guidelines that we've been given, we will have regularly scheduled face mask breaks. We want to have some level of consistency about that. So we are beginning to have those talks, but we've at this point settled on 2 to 3 minutes for a mask break while a child is seated in class during instruction where there is no movement around the room. And if a child is in an elementary classroom and they're not necessarily in a period by period schedule, 5 to 6 minutes per hour. And again, we're trying to make sure that we have students seated at the time that those face masks are taken and the teacher is not moving around the room just to maintain safety for all involved.
Thank you. I'll skip another screening process since we just did that one, but I'm sure it'll come up again. So how about this one? Will you be teaching the students proper hygiene, hand washing, and social distancing practices?
I'll take that again. Most of what we will do early in the school year will be to help students understand what those proper hygiene, hand washing, and social distancing practices are. That will be a big part of what we will be doing with our children when they first get here in the fall. Not to mention the social emotional health aspect. We know from the surveying that we've done with our community and talking with families that this pandemic has caused a lot of social emotional concerns for not just the students themselves, but for their parents, family members, and our staff. And so all of those things will be a great emphasis when we come back in the fall, and we'll continue well into the school year.
Thank you. I'll take a second to remind anyone that might be tuning in late that all of these sessions are being recorded. You'll be able to watch yesterday's session and the next two from the school's website, Facebook page, or YouTube channel. So the next question is about fire drills. How will fire drills or other emergency situation drills be implemented?
The guidance that we've received talks about the importance of maintaining social distancing while we're conducting the drills. Practicality, though, says that there are some of those drills where it's important that we make sure that children and staff members understand that in the case of a fire, we're to get out as quickly and as safely as we can. So we're going to do a combination of drills this year. And again, we'll have social distancing in mind, but if you've ever seen a fire drill that any of our folks have conducted in our buildings, it is always very orderly. We've been talking with the Homer Fire Department, and they agree that we can safely move students out of the building with their masks on and maintain the social distancing practices once we're outside. So we'll be doing a combination of those this school year so that all of our students and staff understand what the expectation is. Great.
Thank you. This next one will stress my ability to pronounce medical terms. So it's about nebulizers. Am I pronouncing that right? Are nebulizers allowed in school, as some people may have specific medical needs?
I can take that question. Current CDC recommendations are that we use spacers with a metered dose inhaler. So that's something we typically do here at school when at all feasible instead of nebulizers. However, if your caregiver, your provider has ordered that your child does need a nebulizer treatment, we must provide that treatment. We would work case by case in this situation, talk to the parents, maybe contact the physician and see if there were other treatments that would be safer in the school setting, if at all possible.
Thank you. And we'll stay in the medical arena with a question about immunizations. Are there any rules, regulations, or protocols regarding current or possible future vaccines that parents should know about?
And that's another good question. That is one thing that the state has not made any changes for. Immunizations must be up to date for school entrance. And there are no exceptions. So they need to be up to date. And this is also for students that are doing home learning. So home learning and in-school learning, you must be up to date on all your immunizations.
Great, thanks. Might be a similar theme. Is there a way to identify those who may be contagious but not symptomatic?
Unfortunately, the symptoms are very general, and we've all heard of the asymptomatic spreaders. So no, there really is no way to tell who is asymptomatic and is positive. Only with a test would you know. That's why it's so important for us to follow the guidelines, keeping 6 feet apart, wearing our masks, washing our hands. All of those things are in place to protect us.
Thanks. Next question is about coordination with the local medical community. Were Cortland community or regional medical providers consulted in our planning efforts?
Yeah, absolutely. We had on our reopening team both folks from the Cortland County Health Department and from the Cayuga Medical Center. Since the plan has been in development, we've also had conversations with the fine folks over at Guthrie Cortland Medical Center. And so we'll be coordinating with them throughout the school year as we move into the fall.
Thanks. Well, let's keep going with these questions for now. Will the school be providing masks to students?
We will. Mike, you want to take that?
Sure, I'd be happy to. So along with providing masks, we will provide masks to both students and staff. Starting off on the school day, if a student is riding the bus to school and they don't have a mask will be provided immediately for them on the bus. We have provided a breakdown of essential PPE for both students and staff. Some students require additional PPE based on maybe special needs that they would have, or medical requirements, and we are providing them for both students and staff. One of the things that we have talked about, especially for speech and language, is providing a mask that has a clear face in order to allow both staff and students to be able to communicate effectively. One of the questions we had was, can people bring in their own mask? And our answer to that is yes. We just want to make sure that any kind of mask or face covering that's brought in is compliant with the CDC and all the health guidelines. Another part of that too is that for our younger learners, the question arose about being able to use the lanyard masks. Again, those are great to make sure that your child comes home with their mask at the end of the day or doesn't lose it during the day. Anything that we can do to assist the children, again, that fit within the guidelines, we would encourage parents to take a look at. One of the things that was looked at was the talk of barriers or dividers. Again, with rules as far as New York State Education Department and facilities, there are parameters for the shields that we have to use, whether during screening, during the process of people visiting offices, or work with children who are physically unable to wear masks. So again, the district has paid particular attention to making sure that we meet the requirements and the needs of all staff and students in this area.
Thank you so much. Next is about testing and tracing. What is the testing and possibly tracing program? Will students need to be tested in school?
I'll start with that, and Janie, if you want to add anything, you can. We will not be doing testing or tracing in school. What we will be doing, though, is we'll be consulting very closely with the Cortland County Health Department. They will be advising us on all of those things, asking us for information. If there is indeed someone who is COVID-19 positive, it's our responsibility to provide them as much information as we can with who that individual has come in contact with. But we have been given guidance that we are not to, which makes sense because we're not experts in the area of testing for COVID-19. So we will not be testing or tracing, but again, working closely with the health department in doing so.
Thank you. Next question is about a symptomatic student. If a student has any symptoms of illness, will they be sent home? How will you determine if it's COVID or something else?
Janie, you want to take it?
I can take that one. The answer is yes. Any of the symptoms I mentioned earlier trigger a positive COVID symptom. they will be sent home, and you will need to follow up with your healthcare provider and for testing and a note to return to school.
Next question is about hallways and common areas. How will social distancing be achieved in hallways and common areas? Will there be additional monitoring?
I'll take the shot at that. Mike, if you want to add anything, please feel free to do so. We are going to have a great deal of signage in the hallways, both arrows to point students in the direction that they should be traveling while in hallways. We'll have cones in the middle of the hallway to denote two-way traffic. We will have adults in the hallway to monitor the movement of students throughout the school day. Our schedules in each building are being built with the idea of minimizing student movement throughout the day. That becomes more difficult at the secondary level. Our elementary folks that are familiar with the elementary school know that it's been current practice that students move with their class. So that'll be a little bit easier to move students through the younger aged buildings because they're used to being in lines and somewhat staying away from the person in front of them. But we are building those schedules to minimize movement in the hallways.
Thank you. Next is a question about the nurse's office again. For students new to a school building, will they be able to be shown the nurse's office so they know where to go? And then secondary to that, how will medications be delivered to the nurse's office? And how will you handle children being sent home when they're sick? A little bit of a repeat, but if you don't mind.
No, not at all. We will have separate areas in each building for the nurses' areas. We'll have an area where we can provide healthy children with their needs, whether it be medication, needing ice, a minor injury. There'll be a special place for that. For students that have symptoms, we'll have a special area for that to triage, and then any positive symptom, as I mentioned before, will go immediately to our isolation area.
Thank you. And once again, I apologize if this is repetitive. I know we're not going to do testing in school, but will COVID testing be offered prior to the beginning of school if students or families wish to partake?
We have information of where families can go to get testing. It's available in our reopening plan on the website, but certainly if someone called and asked where we would direct them to get a test, if that's something that they wanted to do, we would be more than happy to do that.
And that probably rolls into the next one. Has the district considered partnering with Cortland County Health Department, Central New York Regional Hub, Onondaga County Health, or similar agencies to pool testing samples, procedures, protocols?
That was part of our conversation with Cortland County, with the health department specifically. I know that Onondaga County schools have been talking with the Onondaga County executive and the health department up there to do that kind of testing. Cortland County at this point is not in the position to do that for us. So at this point, we won't be entering into any sort of testing or pool testing sampling with anyone.
Okay, next is hand sanitizer. Will hand sanitizer be available throughout all the buildings? And will students who ride the bus be able to bring their own?
Luke, I could take that question. The district will provide all appropriate hand sanitizer for students and staff while in the building. What we have asked is that staff not provide their own personal hand sanitizer to students or other staff. Staff should not have hand sanitizer, so our bus drivers may not have hand sanitizer by law on the buses themselves. If students choose to bring hand sanitizer to school, and again, we would make sure that the use was age appropriate, we would ask the students to keep the hand sanitizer in their backpacks or book bags or bags while on the buses. Again, with this, we'll make every accommodation for children who may be sensitive, physically sensitive to the hand sanitizer that we've provided for the school district, and work with families if they need to use some type of alternative to that. Again, making sure that they fit the guidelines that the school districts have to follow. One of the things I can also add to that is that soap and water is our best alternative to make sure that kids are keeping their hands clean.
Thank you so much. The next is about a positive test. If a student or teacher tests positive or displays symptoms of COVID, what is the district protocol? Will they have to quarantine? Will the classmates or coworkers have to quarantine?
And Luke, I'll start, and Janie again if you want to add detail to it. As I mentioned before, we will work very closely with the county health department if there is indeed a positive case, whether that be a student or a teacher. There will be quarantining that will be involved. They'll do contact tracing, identify again who that person has come in contact with. And we will make sure that we provide the best information we can to the health department, and then they will do all the follow-up in terms of contacting families, staying in touch with those families to make sure that that all is going well with the quarantine.
To take that one step further, in a worst case scenario, would multiple positive cases trigger specific building closures? Would all buildings have to close? How does that work?
The easy answer is there is not an easy answer to that. It's a case-by-case situation. I know if you've watched the news around the country, there have been situations where schools have closed down or quarantined a couple of classes and their teachers. And in another case, you've seen they closed an entire school. And in another case, you saw that multiple buildings in a school district had to close. So it really is case-by-case dependent. The key being identifying to the best of your ability who's potentially COVID positive, and trying to make sure that they don't spread it further by being out and about in the community.
And to flip that to the good side, is there a scenario where if the numbers stay low and everything works well, that we can get back to normal, quote unquote?
It's tough lately to remember what normal looked like, but there's always a goal and a hope that we will return to that someday. And again, it just like there's not an easy answer to what would it take to determine if you close a building or a classroom or an entire district. Again, there aren't clear guidelines that are there in black and white right now to determine when things could go back to normal. But we would always, and again, I might sound like a broken record, but we're always going to be listening to our local Department of Health, our state Department of Health, and the governor's office to determine what we should be doing in terms of returning to some semblance of normalcy.
Thank you. The next question is about the deep cleanings. We understand that the junior high and high school will be deep cleaned on Wednesdays with the hybrid model. Right. What is the cleaning schedule and procedure for the other buildings, given that the younger students may be attending every day?
I can take that, Luke. So in understanding our cleaning schedules, the deep cleaning and disinfecting for 7, 8, and then our high school rooms every Wednesday will allow us to concentrate our efforts with our custodial staff to get into the buildings during the day on that Wednesday. However, we will do a full clean in all buildings every day. We're working with our custodial staff, with our director of facilities, to make sure that we're scheduling staff to come in during the day to make sure that, number one, bathrooms will be cleaned on a rotational basis, on an hourly basis, and those are bathrooms all the way through each school. A class will be cleaned, surfaces cleaned when the students are not present in the classroom for K through 6. In the case of 7 through 12, when students are moving to other classrooms, I know that the schedule is now providing for a longer period of time for children to safely get to their class, socially distanced, but also during that time to allow staff to assist with custodial staff to wipe down surfaces. As part of our cleaning plan, all of the high-touch areas, doorknobs, light switches that are touched by students and staff during the day will be addressed and cleaned. Again, cleaning and sanitizing bathrooms for classrooms that have bathrooms right inside the classroom. There will be scheduled times where someone can come in and clean that. For those eating in their classrooms during the day, there will be a schedule to have sanitation and cleaning done in those classrooms as well. What we have purchased throughout the district, and we are fortunate enough prior to COVID, when we had a flu outbreak in the district, is we had electrostatic machines. They were Clorox machines. We had one in every building and one in the bus garage. Being proactive based on what the Board of Education had asked us to do in the springtime, we've purchased an additional 20 handheld electrostatic sprayers, which we will be able to get into classrooms. For those of you who don't know what the sprayers are, it's a quick move through a room where it's a vapor that will travel and land on surfaces. And again, on the surface, it takes about a minute for it to fully sanitize that surface. The nice thing about those as well, they also get in nooks and crannies where if someone is cleaning with a disinfectant cloth or a wipe, you may not be able to get into those surfaces. At the end of every day, we will go in again and make sure in the K6 rooms that a deep clean is done. We are asking staff to kind of button it up, so to make sure our custodians can get in there on a split shift to do a deep clean. Along with that, on our buses, we will actually be sanitizing after every run. And at the end of the day, we will use the handheld electrostatic sprayers to go back on the buses prior to the morning run the next day to make sure that we're doing a deep clean on those as well.
Excellent. The next question is about lockers. Will students be able to use their locker, or should they plan on carrying a backpack around?
In keeping with the theme of trying to minimize traffic in the hallways, we're going to be working with our building administrators to not have students utilizing their lockers this year. That will greatly lessen the number of students in the hallway at one time and in the hallway for extended periods of time. That will be quite a significant change, but we're going to do the best with the situation that we have and make a good game plan for minimizing the need for students to carry large numbers of items from classroom to classroom.
Right. Here's another little wrinkle on the mask and hand sanitizer question. Can students bring their own masks or hand sanitizer? And specifically to the sanitizer, what if they find they have allergies or some of the sanitizers give them a reaction? Can they bring their own in that case?
I can take that again.
Yeah.
So again, looking at the masks, as long as they are compliant and with health codes, people can bring their own masks. Both staff and students will be able to bring their own masks. Again, with that, and not touched upon earlier, we would ask that if people are using their own masks, that they are making sure that they sanitize them regularly. To go along with hand sanitizer, if a child is sensitive to the hand sanitizer that we have here in school, we'll definitely work with families to make sure that we have the best fit for a student. And again, within the parameters of what we're allowed to have in the school district.
Thank you. How about PE class, gym class? Will the students need to wear masks? Is it possible to social distance? What's physical education going to look like from a health and safety standpoint?
Sure. The guidance that we've been given so far is telling us that we have to not have just 6 feet of distance between students when they're participating in rigorous activity, but 12 feet in addition to wearing a mask. So our students will be asked to wear a mask and be 12 feet apart. It'll be a challenge to put together PE activities that allow them to do that. But I have confidence in our staff that we'll be able to pull that off and do a good job with it. One thing, Luke, I would want to add about masks before I forget, because it is a question that I've certainly been asked by our staff, but by members of the community I've seen out and about as well. And that is, what do we do if a child or a staff member, for that matter, refuse to wear their mask? And I do think it's important, and I did mention it last night too, and I will tomorrow night as well. We are not going to have a lot of patience. We'll help coach a child up to put their mask on, unless they have a medical condition for which they can't. But we're going to expect that students and staff wear their masks. And in the case of students that refuse, that will be an indication that we need to contact their parents and let them know that if we can't fix this, then we'll have to have that child learn from home.
Thank you. And I'll take another minute to remind everyone that these sessions are being recorded. You can get them off the website, the Facebook page, or the YouTube channel, both last night, tonight, and tomorrow, if you want to go back and revisit any of these questions, as well as the frequently asked questions on the website will be updated once we get through all of this, and you can find some good information there as well. So the next question is back to screenings. In the reopening plan, we state that students need to be pre-screened. Any student that has not been pre-screened will be temperature checked prior to entering school. How will the school know who has been screened and if the screenings are accurate?
I'll take that again, Mike.
Sure. What we are looking to do and to make sure in the screening process, again, If a child is not screened prior to coming to school, they'll have their ID card or the ability for a staff member to put their name into the dashboard to find out whether or not they've been screened. And from that point, if they have not been screened, they will go into the screening line and be screened. It's a great question that what will we do if someone doesn't put down truthful information into the screening portal? I can answer this question as an administrator, and I can answer this question as a husband and a father, having both my wife working at the intermediate school and my son as a student there as well. It would be my hope for the safety and the health of everyone involved in Homer Central Schools that people are truthful. The only thing that will result in the fact that if someone comes to school knowingly sick is that the sickness will spread. And we know that in the school system that would happen. So I don't have a concrete answer of what would happen or what would be enforced if that were to happen. It would be my hope that people would do the right thing and follow the screening process and health procedures that we've set forth.
Thank you. And a similar theme, and maybe a repeat again, I apologize. What steps will be taken if a student becomes symptomatic while at school? Will they be placed in quarantine? And are there any special instructions for the parents to come pick them up?
I'll take that. They would immediately be taken to our isolation area, and we would contact parents for pickup, and we would expect that to be as quickly as possible. And we hope to have a paper that we will be sending home to give you guidelines of what is expected to take place once you leave the school so that your child can return. And we will have that updated as we go along.
And Luke, before we move on to the next one, I just wanted to add, and to kind of jump on what Mike was saying, it's really important that obviously people be honest, but secondly, that we have accurate contact information, that it's up to date, and whenever it changes, if you could please let our school personnel know. The one thing that we don't want to have happen is to have a student who is not feeling well in an isolation room for an extended period of time, especially when we may have a number of students in there. It's just not a healthy situation, and we don't want to put anybody in that predicament. So when we send home information here in the next week or so that asks you to update your contact information, if people could do that as quickly and as accurately as you can, we would really appreciate it. It'll help us make sure that we're doing the safest and best thing for you and your children.
Thank you. A couple of specific questions about masks. Is it okay for a student to wear a lanyard with their mask so they don't use it? And then a similar theme on some questions, are neck gaiters okay, face shields, any other alternative to masks?
As Mike had mentioned a bit ago, Luke, lanyards, yes, you can have a lanyard if that helps a child, especially our younger learners, to be able to make sure that their mask is with them all day. Yes, they can use lanyards, and we will have to look at what those particular other face items look like. We have to make sure that they follow the guidelines that we've been asked to enforce so that they're actually doing what we're hoping they're doing. And that's preventing the spread of the illness.
Okay. The next one gets into some mechanical engineering terms, so I apologize if I get any of them wrong, but they're related to the HVA system and air quality inside the buildings. Please discuss any measures in place to improve air quality and ventilation, such as HEPA filters, MERV 13 filters, and ASHRAE recommendations as far as making the air clean and doing what we can with air quality.
I can take that, Luke. All of our univent systems at present time, the filters and the summertime program that we have to make sure cleaning and maintenance takes place. At this point, with the filters in our univent systems, we have the highest grade that we can have in there that will allow the system to function, again, with the pressure that has to be equipped inside the univent system and allow airflow to come through. The talk right now on the MERV 13, those are used in some of the bigger industrial malls, things of that nature. At this point, for any unit that would require that in the district, we have ordered those filters. Again, please understand that with the governor coming out with the edict and looking at things through the CDC and the EPA, those are at a premium, but we have put filters in place, new filters, a process to check filters, to check our systems on a more than regular basis to make sure everything's functioning and balanced. Again, rooms that need additional air filtration or air movement, we are equipping with the HEPA filter systems. Again, the size of those systems will be based on the square footage of the room themselves. Our nurse's office will be equipped with HEPA filters. Our isolation rooms, as per the guidance, will be furnished with HEPA filters, but again, they will have negative air pressure units within them to make sure that they're catching the additional particles that may be expelled within that room. And again, we will follow the process for making sure the filters in those HEPA systems are cleaned and maintained as per guidance. Along with that, talking about air handling and air within the rooms, the guidance has told us that windows may be open during the day. Again, that would be at the discretion, that you would not want a window open with a windstorm outside or steady gusts of wind coming through. That would defeat the purpose of our air systems. And again, with wind blowing directly across desks or directly across students, moving particles. That also goes along with having fans. At this point, we will not have fans in windows because of the relation of moving air directly across areas where students would be seated. I know that a question had come about in several areas. We will make sure, in working with our HVAC companies, those that actually provide the controls to our systems and the physical systems themselves, to make sure that everything is balanced as per EPA and CDC guidelines as we proceed through the seasons. As we know here in central New York, especially as we move into the fall, we'll have days that get near 90, and we'll have days that will be hard pressed to break out of the 50s. So in that process, we are working with our vendors to make sure that our systems are operational on those days.
There's also a similar question that also came up last night for when the weather is nice. Can some of the classes be held outside?
Absolutely. And while, again, we won't designate outdoor spaces for that purpose, certainly if the weather permits and a teacher wants to take students outside and it's appropriate to do that for the lesson that they're working through and the social distancing is kept in mind, we would love to get children outside as much as we can, especially when we know that the sunny weather that I'm looking at right now is not going to last forever.
Yeah. Unfortunately. Next question is about the local colleges. Our proximity to local colleges is concerning. Has Homer considered delaying in-person learning to make sure the colleges have things under control as their students return?
One of the things that we've been working through since March is a huge level of uncertainty. And while that certainly is one, we don't know. I have a pretty good idea in terms of what the colleges are doing as far as screening and testing goes. That's nothing that we can control. What we can control is making sure that we have our practices and protocols in place to do our best to make sure that we're promoting healthy hygiene habits and keeping people safe. And that's where we're going to concentrate our efforts and do the best job that we can to make people feel comfortable and positive coming back on September the 8th.
Thank you. The next is about the staff and the teachers. Has Homer staff been surveyed to see if they are comfortable returning to in-person learning?
We've had a couple of conversations now with our staff and talked through the reopening plans that we currently have in place. 2 weeks ago, I had sent out some information to staff asking them if they had any medical conditions that would preclude them from coming back, or if they had any accommodations that they might need for us to consider for them to come back. We've also tried to take the tack that by answering questions and giving people information will make them feel more comfortable coming back in the fall.
Thank you. The next is about masks and social distancing. What is the logic that kids have to wear a mask if they are socially distanced at 6 feet apart? And is there a chance this policy changes as the year progresses?
The one thing that I've become accustomed to our guidelines changing. And we've learned to make the best out of a situation that certainly is less than ideal. So the answer to the question, could the practices change? Absolutely. But right now, the guidance is requiring us to have students both socially distanced and wearing masks.
How will the playgrounds be sanitized in between sessions of recess?
I can take that. To go along with our district cleaning plan, we will have custodians that will go out and clean the high-touch areas of the playground. So again, taking a look, doing an assessment of the playgrounds, figuring out which items are highly used by students, and making sure that we're cleaning those high-touch areas. We'll do that periodically during the day.
Thank you. And then the next question is a similar one about common spaces and bathrooms. What's the sanitation plan for those? And also, will there be a limited number of students that can be there at a time?
I'll take it. And the answer to is, will there be a limited number of students? Yes. As far as the cleaning and sanitation of those areas, they'll be done on an hourly basis, as Mike had pointed out earlier. But certainly we have to do a good job of identifying when it's been cleaned. So we'll have a process in place where the custodian, after they've cleaned that space, will turn a card from red to green to allow the next folks that are going to be using that facility to know that it's been cleaned and sanitized.
Great. The next question is similar, but about teachers' classrooms. Will teachers moving from room to room disinfect their workspace before leaving that classroom?
Want to take that one?
So for teachers moving room to room, yes, we would ask that not only the case of teachers, but after students have left an area, we would ask for that area to be disinfected.
Great. The next question is actually about mental health and safety. Has there been any training for staff for mental health emergencies in addition to regular health emergencies?
That'll be an ongoing process, Luke. As I mentioned earlier, the social emotional aspect of this pandemic can't be underestimated. And so we have already begun offering professional staff development through the summer that teachers have had an opportunity to partake in. But certainly that'll be a focus for when we come back prior to the students returning. We have our staff back on September 7th and September 3rd. But again, it'll continue well into the fall and beyond.
Next is a notification. Will the community be notified of positive or suspected cases of COVID?
We'll work closely with the Cortland County Department of Health and follow their guidelines and certainly notify the appropriate people so that folks have an understanding of what's going on in this community.
Next is a procedural question for students leaving. Let me see if I can get this right. What is the process for returning to school after a medical appointment or illness? Is it still a doctor's note or is there something new?
Jeannie?
I'll take that. Anyone that goes to just a normal doctor's appointment won't need anything special. We would anticipate a note from a parent saying where they're going and when they would be back. It could be the same day. It might be a whole day that they are out. Anybody, though, that is sent home with an illness that is COVID positive symptoms has a very strict return that we will be looking for. We'll be looking for, at minimum, a doctor's note saying they can return to school. We will be looking for a negative COVID test result, and we would expect a resolution of the symptoms that they were sent home for. If we sent someone home for something that was non-COVID positive type symptoms, a doctor's note would suffice to come back.
Thank you. The next one seems to be about air quality again, or the possibility of an airborne illness. Have you considered that long periods of time in a room with occasional mass breaks in the room may increase the spread of COVID?
Obviously, I'm not a healthcare expert, but the guidance that we've received from, as I mentioned, the CDC and the Department of Health is saying that those things that we're going to be doing are appropriate. So we're going to rely on our medical experts and again, do the best that we can to make sure that when we do have those mask breaks, that children are sufficiently socially distanced and not moving around the classroom.
Thank you. We had a question about wearing masks during PE gym class. How about sports? If sports return, will masks be required for sports?
The good news about that is there will be additional guidance given because that, again, is another whole set of guidance that we haven't spent a lot of time with because athletics has been delayed as it stands right now till September 21st. We did get some information from the governor's office today that he would be making an announcement next week about the status of high school, both junior and senior high school sports. So we'll have some of that information, but certainly, again, we'll follow the guidance that we're given about what are the best practices as it relates to health and safety while participating in athletics.
Thanks. Will staff members be physically handling ID cards? And is that a concern?
Our plan is to have the ID cards on the lanyard. And so the child would present the lanyard and the ID badge, and at which point the person who would be scanning it would scan it without having to touch it.
Thank you. Next is a question about symptoms related to other things, like if a child has asthma or just a cough, will they automatically be sent home? Is there some different protocols in that scenario?
That's a good question. With asthma, most likely your caregiver, your provider will send an action plan, an asthma action plan that can help the nurses make some decisions. However, a cough is one of the COVID positive type symptoms we would send home, and we're unable to tell if the cough is COVID related or related to other things such as asthma or allergies. So it's a very tough call, and we will be following the CDC guidance and sending those students home.
Thank you. I think we probably answered this already, but the question is, will playgrounds be off limits or will there be any kind of restrictions as to what equipment can be used?
I'll take that. Mike had answered the part about the cleaning and sanitizing, but certainly we have to also keep in mind the social distancing restrictions when it comes to playgrounds. I said last night, and I'll say again tonight, our goal is to make the children's experience as normal as we can, given the restrictions that are put in place. So while playgrounds will be usable by our students, we'll certainly have to limit the number of students that are out there at any one time to maintain that social distance.
Thank you. Another question back to students being non-compliant with wearing their masks.
Mm-hmm.
Will there be some leniency or educational time for elementary students if they're struggling with wearing the masks?
Much like with any rule that is established, there needs to be an opportunity for children to learn what the expectation is. And so much like we do every school year when we start talking about things that we'll have to have in place for children to meet with success, we'll do the same this year too.
And similar to that, are there any additional resources available for students who are having trouble adjusting, experiencing anxiety or extra stress? Any new protocols with the social workers or anything on that front?
Our social workers and school counselors and school psychologists have had and continue to have conversations about some of the social emotional challenges that we'll be facing, that children will be facing when they come back in the fall, and have been talking about what are those things that we have to be ready for. And so while you can't anticipate everything, they certainly have anticipated a large number of those and are ready to help kids when they come back in the fall.
Yeah. And I know we've answered it once, but multiple questions about tracing and notification, that if a student tests positive, will the parents of their classmates be notified? How's that going to work again?
And I'll defer to Janie if she has additional information. And I will fall back to following what our County Department of Health will advise. I'm not sure if a parent's child has not come in contact, I do not believe that we will be notifying families about a positive COVID case. I believe the only time anyone would be notified is if they had come in contact with that individual and would need to be quarantined. But we can get, and Janie, unless you have a better answer for that, we can certainly make sure that that's the answer that's correct. But I believe that is how they would go about notifying folks.
Okay. The next question is specific to the pre-screening. Since students won't enter the school building until they've passed their health screening each morning, where will the pre-screening be done? I'm sorry, where will the pre-screening be done during inclement weather?
We are identifying in each of the buildings a place where the screening will take place. And taking into account the fact that the weather that I'm looking at right now, as I said earlier, is not going to be like that forever. We'll be notifying families and actually doing videos that we'll be sharing with our families ahead of September 8th, showing them at each of our 4 locations where the screening areas will be, where the parent pickup and drop off will be, so that both children and parents have a level of comfort with that.
Okay. A couple of questions about how absences will be handled. Will the amount of absences be waived this school year, or will there be a backup plan set up for children with mild symptoms? I guess if children have to be out more than expected, is that going to be a problem?
Again, I'll start, and Janie, add if you want to. We've not used absences as a means to make a lot of our decisions about students in terms of if they would be moving on to the next grade or if they have met with a level of success. We'll be following the guidelines that are established, and that's where we find ourselves now. We won't be able to say that Johnny can come back 4 days early because Johnny unfortunately has missed a number of school days. We'll have to follow those very rigid guidelines, but guidelines obviously that are there for a reason.
Right, right. Is there any possibility that temperatures can be taken before the student gets on the bus, which may cross over into tomorrow's topic?
Yeah.
I can take that question.
Okay.
That's a question that's come up to us quite a bit, for children to be screened prior to getting on the buses. In the Homer Central School District, we cover 164 square miles on our bus routes. That being said, many of the places that we're picking up children are not very advantageous, number one, for keeping the bus pulled over to the side of the road for any period of time, but to be able to do screening, if it was done by the bus driver, we'd have to turn off the buses, the individual would have to leave the bus, which doesn't follow our DOT rules. That being said as well is that many families at times will allow the child to wait at a bus stop prior to getting picked up so they could make sure they get to work. In that process, if we had a child fail screening, we really don't have a process to make sure that someone is able to take them either back into the house or to an area where they may need to receive some medical treatment. So again, in a perfect situation, we would be able to screen prior to the children getting on the buses. I know that that's been done in some areas that have been on the news stations. Just given, number one, kind of the physical layout of our district, following DOT guidelines, and again, making sure that if there was a situation where we didn't have a parent that was readily accessible for a child, we wouldn't want to be in that situation for the child, for the other students on the bus, or the bus driver.
Thanks. Will students be eating lunch in their classrooms, and are there any health or hygienic concerns with that?
They will be in some of our buildings eating lunch in the classrooms. Our food service department, we have had them purchase a butcher block type roll of paper pre-cut that will be given to each classroom teacher prior to lunch being delivered to the classroom by our food service staff. The children will be able to grab one of those, put that on top of their desk to lessen the amount of food that is spilled out onto the desk surface. After they complete their lunch, they're able to take that, wad it up, and throw it away in the garbage can. And we are providing in each of our classrooms for the teachers' use wipes, disinfecting wipes, that then they could wipe down those high-touch surfaces if that's needed.
Thank you. I'll take one more minute to remind everyone that these sessions are recorded. You can watch them again from the school's website, Facebook page, or YouTube channel. That also tomorrow's session will focus on transportation. So some of the questions coming in about transportation related items will be covered tomorrow. But we have some more here today. If we can just press on through, I think we should get to them. Some are nice reactions to previous conversations we've already had. This one about lockers. If a student can't use a locker, how will they change for gym class?
We won't be having our students change for gym class this year. This will make many of our students happy. It will also give us more instructional time where students won't have to be taking 3 to 4 minutes on the end of each class to change. So we will not be having our students change for PE.
Thank you. And back to recess, maybe a repeat, but are masks required at recess outdoors?
They are.
Easy enough. We mentioned students being able to use their own masks earlier. How will you communicate to the parents what type of masks are okay, whether they're within the guidelines, and then how will you monitor that once the kids get to school?
Well, the good news is that prior to coming into the school building every day, our students will go through one of 2 pre-screening lines. That'll give us an opportunity to see what masks students have. We'll also rely on our classroom teachers to let us know if they believe that there's a mask that doesn't meet the guidelines that we have been given that we needed to follow. We will then communicate with a parent and identify what, first of all, is wrong with the mask, if that's indeed the case, but then also provide some information for them about what would be appropriate. Not to mention, we also have masks that we can give to that child that day, so that won't be a problem for them.
Thank you. Slightly off topic about school resource officers. First of all, it's a 2-part question. Will the school resource officers be in each building this year, like past years? And will they have a role with enforcing mask rules and monitoring spacing and hallways and that kind of thing?
Our school resource officers will be in our buildings this year as they have in the past. We've been blessed over the last few years to have 1 officer in each of our buildings during the day, and then a 5th officer that is on after hours. We'll look to reallocate some of those hours this year, depending upon if we have after-school activities and athletics. But yes, the school resource officers will be out and about. We try not to use our school resource officers to be the enforcer. We try to have them be more of an educator and be more proactive in their interactions, build relationships with students. Certainly if they see something in the hall, hopefully they've built relationships with kids and they can talk to them in a positive way about doing the right thing and following expectations. But yeah, so our school resource officers are critical to help us build relationships with students and make sure that we're going about our business in a correct way.
Okay. This one probably bears repeating again, but it's about symptoms and minor illnesses. If a student coughs in the classroom, will they be sent home immediately? Will a tickle in the throat cause all kinds of problems?
I'll speak for Janie. One of the things that I know our staff are very sensitive to, and not just our nursing staff, but our teachers. We are not going to diagnose in classrooms, meaning we're not going to attempt to say, well, that cough is definitely not COVID related. But we also understand that sometimes you have a tickle in the throat, and we're not going to be sending students on a regular basis out of the classroom for something that's fairly common. Okay.
Another question of parents looking for information for how their students can get tested before the school year starts. Is there a way we can post that or share it now for where they should go and how they should handle that?
Actually, if it's on our building or our district website right now, if you go into our school reopening plan that's posted on our reopening page, under the health and safety area, it lists the 3 areas that you can contact, or 3 organizations that you can contact: Cayuga Medical Center, Guthrie Cortland Regional Center, and the health department. However, the health department most likely will direct you back to one of those 2 organizations. So there is testing available right now, and then you can certainly go to our webpage and find that if that's something that you want to do.
Thank you. And since I thrive on repetition, the last question that's in my email box here is back to the masks again, but it probably bears repeating. How can parents be sure that homemade masks meet the CDC and school guidelines? How can we be sure that homemade masks are properly sanitized? And how is the district going to enforce the mask protocol?
Again, masks are a critical component that we have in place to help ensure student and staff safety. So we are going to take it very seriously. If we see that there's a mask that doesn't meet our guidelines, we would immediately give that child a mask that does, and then make contact with the family so that they have an understanding. I believe that most of our families understand the importance of wearing an appropriate mask and will do their best to do that. So I don't anticipate people that are going to give us a lot of difficulty in following that. Just keeping a line of communication open is going to be really important, and we'll be sure to do that so that we can take something that's a relatively small event and not let it get bigger than it needs to be.
Very good, thank you. And before we wrap up tonight's session, any final thoughts from the panel?
One thing, Luke, I would like to add, I'd like to thank all of the people that have taken the time tonight to tune in. It's important that we work together to make the best plan for our community. The school, as you know, is the community center, and we want to do all that we can to make sure that your children are safe, that they're happy, that they're learning, and that you feel comfortable having them here. The best way to do that is to continue to communicate. I'll do my best to update you as we move forward with our planning. We know that we have a very short period of time before September 8th, and we'll do our best to get information out to you in a timely fashion. If you have any questions, any concerns, please reach out, whether it be by telephone or you can use the Homer School Reopening at homercentral.org email, and we'll be sure to touch base. We'll also be taking all of these questions that we've been discussing over the past few days and putting them on that frequently asked question document. But please stay in touch, and please let us know if you have any questions, because together I'm comfortable with the fact that we're not only going to put a good plan in place, but it will be a great one for your kids. So thanks again for tuning in.
Thanks again, and we'll wrap it up. I'll invite everyone to join us tomorrow for transportation and food service questions. And thanks again to the panel and the staff behind the camera for putting all this together. And we'll see everybody tomorrow. Thank you.